Welcome back to my channel, and in today's video we are going to talk about the biomechanics and pathomechanics of the muscles around the knee joint. We know there are different groups of muscles around the knee joint, like the knee flexors, knee extensors, medial rotators and lateral rotators. In this session we are going to talk about the knee flexors in particular, and you know there are different groups of muscles, different muscles acting as the knee flexors. About 7 muscles are there which have some knee flexion role. We are going to discuss each and every one, in particular the biomechanics and pathomechanics. But if you wish to know only one particular muscle or a group of muscles, you can check the time codes which are given in the descriptions and the comment box. Let us discover about the knee flexors at first. As I told you, the muscles around the knee joint in general can be knee flexors and knee extensors along with that medial rotators and lateral rotators. Right? Now we are going to discover about the knee flexors in particular. Do you know how many muscles are there which can have a significant role of knee flexion? There are 7 muscles. There are 7 muscles which can have a role in knee flexion. Can you tell them? That is very simple. The first group of muscle is the hamstring, which includes semimembranosus, semitendinosus and biceps femoris. For your reference, that there comes the 3 muscles. The second muscle is the sartorius muscle. Third muscle is the gracilis muscle. The fourth one is the gastrocnemius muscle, and the next muscle is the popliteus muscle. See how many? 3, 4, 5, 6, 7 muscles. There are 7 muscles which are very important in knee flexion. In some individuals, an additional muscle known as the plantaris muscle is also seen, but this is not seen in all individuals, so we do not take in particular flexor. Now let us discover the peculiarities of each of these groups of muscles. The first one goes to the hamstring. And I'm not going to discuss about the anatomy over here because it's quite known to all of us. And we have a video in our channel about the hamstring muscle, that is a posterior compartment muscles of the thigh region. You can check back to that. The link is given above. Alright, let us focus about the biomechanics of hamstring muscles. We know that the hamstring is made up of 3 muscles: semimembranosus, semitendinosus and biceps femoris. Along with that, those 7 muscles, most of them, almost all of them, are 2 joint muscles, except the short head of biceps femoris. What happens if the muscles are 2 joint? They are subjected to active insufficiency and passive insufficiency, or either the position of these muscles at both the joints in which they cross is going to affect their length tension relationship or affect their ability to generate force. That is, when they are generated or used simultaneously in both the joints, or they are simultaneously acted either in passive motion in 2 joints, it's going to affect the efficiency of that muscles. Right? Yes. Now going on to the hamstring muscle: semimembranosus, semitendinosus and biceps femoris muscle. The chief action of the hamstring muscle, you know that is the knee flexion. That is the knee flexion. Along with that, they are very good hip extensors. They have a great role in hip extension. They are medial rotators, very good, and they are lateral rotators too. See, these muscles have a diverse role in the knee and hip joint. Now, when we look at the hamstring muscle, for example, here we have a hamstring group, okay? And here, let us imagine this is the lateral aspect, this is the medial aspect. Here we have some muscles, here we have some muscles, okay? All of them are lateral aspects. They are inserted into tibia and fibula. Here it is inserted into medial side of the tibia. Same, these muscles are semimembranosus, semitendinosus, and this one is the biceps femoris. So according to their origin, according to their line of action, they have a different role in either medial rotation or lateral rotation. The muscles that are seen in medial side help in production of medial rotation. Very good. The muscles that are seen in the lateral side are capable of producing lateral rotation. That means when your knee is going for knee flexion with medial rotation, the medial part of the hamstring is going to be activated. When your knee is going for lateral rotation with knee flexion, your lateral part of the hamstring, that is mainly your biceps femoris, is activated or active, right? But I told you, always there is knee flexion. If there is a medial rotation of the knee without knee flexion, if there is medial rotation, lateral rotation of the knee without knee flexion, then the activity in the hamstring muscles are very minimal. That means you have some other medial rotators and lateral rotators for the knee. But the role of hamstring is particular only when they are accompanied with a knee flexion. So knee flexion is a predominant role or primary role of the hamstring muscles, right? I hope that is clear. And now we see that among this muscle, one muscle group has a peculiarity, that is a semimembranosus. That is a semimembranosus. What is the peculiarity of that? You remember we discussed about the knee flexion and extension, the motion of biomechanical motion of knee flexion and extension, the posterior translation, the anterior translation. If you haven't, check back, the link is given above. And then we mentioned that the semimembranosus muscle is helping the medial, the menisci, to retract backwards. Yes. In which motion? Which motion it is actually helping? In knee flexion, so that the menisci do not act as a barrier for knee flexion. So we studied that the semimembranosus muscle is actually distracting the menisci like this. Yes, that is the role of a semimembranosus. In particular, it is attached to, it is helping in posterior distortion of medial menisci, Very good, very good. Yes. Let us discuss about the other roles of hamstring muscle. What are the other roles served by hamstring muscle? Hamstring muscles also act as stabilizer of the knee joint. Hamstring muscle act as knee stabilizer. Especially which type of stability? See, this is having lateral rotatory role, this is having medial rotatory role. That is valgus and varus stability. So hamstring muscle has a role in providing valgus and varus stability at the knee joint. Is that all? No. This muscle has a very significant role in the action of ACL. That is because you know that the action of the hamstring muscle is going to posteriorly distract your tibia. When tibia is going for posterior translation or preventing the anterior translation of the tibia, which cruciate ligament is active, ACL. ACL is preventing the anterior translation. So this hamstring muscle is going to help the ACL. Right, it is going to unload the ACL muscle. So when there is an injury to the ACL, there is significant role of strengthening and activation of the hamstring muscle. And in ACL deficient knee, the hamstring has a very predominant role in providing the anterior translatory stability or restraining the anterior translation. Right. So these are the major function of the hamstring muscles. Now, hamstring muscle has a very significant role in the hip joint. We studied that earlier, but let us just revise that. That's very significant role in the hip joint. That is, they act as hip extensors. You know that this is known to every one of us. But do you know they contribute up to 30 to 50% of hip extension strength. The other extensors like gluteus muscles, etc., are active, but this hip extension strength of 30 to 50% is contributed by your hamstring muscles. So they have a predominant role in the hip joint also. All right. When we evaluate the action of hamstring muscle, for example, this is quite contradictory to you. Maybe this may be quite contradictory to your knowledge, but let us just examine that. Okay, let us just examine that. For example, a person is here. He is in the squatting position. He is in a semi-flexed position. Let this be his feet. This will be the knee joint, and let this be his hip joint. Right? This is the knee. Okay. For your reference, let me draw a patella, so that it is easy for you to understand. Okay. Now, when the person is in this particular position, you know that the gravitational force vector or line of gravity passes posterior to the knee joint. Usually it is passing slightly anterior to the knee joint, which is providing knee extension moment. But here you see that in semi-flexed position or in a slightly flexed position, the line of gravity moves posteriorly and produce a knee flexion moment. So since the line of gravity produces a knee flexion moment, the tendency of the body will be for going to the knee flexion. You can imagine that, right? Yes. So in day-to-day activities like descending a stair or sitting down in a chair, we don't need a great activity of a hamstring. Oh God, what is it? Hamstrings are the knee flexors. And how knee flexion is going to happen? Yes, knee flexion is going to happen because of the superimposed body weight, the weight of the head. Yes, because of the superimposed body weight, this knee flexion is going to happen. So you don't need, or we don't have to have the significant role of hamstring in descending a stair or sitting down. The latest study shows that, but we need the significant role of this muscle, that is your quadriceps muscle, because this muscle is going to eccentrically contract and control the knee flexion. If there is a weakness of the knee flexion, a quadriceps, what happens? The buckling of the knee happens. So in order to flex the knee, we don't need much of the hamstring in day-to-day activities like descending a stair, but the quadriceps is very important because it controls the flexion extension moment, the gravitational knee flexion extension moment, right? But I told you this has some significant role in the hip. For example, look here. What is happening in the hip joint? In hip joint, this is anteriorly passing and produce a flexion moment. Okay? Knee hip flexion. Which are the muscles that are going to act against the hip flexion? That is the hip extensors. And you know, hamstring is a hip extensor along with other muscle. So hamstring has a significant role in hip extension in our day-to-day activities, right, along with other gluteus muscle. But what is the summary of this? What is the summary of this? Here we studied that, here we looked into that knee flexion, hamstring has no significant role in day-to-day activity. Without even hamstrings working, we can do that activity. But hamstring has a significant role in the hip. If there is no hip extension, what is the use of knee flexion? Can we stand erect? No. Can we go for the movements? We can go down to sit, but can we come up? No. Descending the stair, does it require knee extension? Yes. Hip extension? Yes. So ultimately, if the hamstring is weak or the hamstring is having some problem, the day-to-day activities will be affected, either because of the role in the hip or either because of the role in the knee. Okay. I hope that is clear, right? If it is not clear, just get back me through my comment box. Yes, that's a role of hamstring muscles in particular. We saw hamstring muscles are the knee flexors, the medial rotators, lateral rotators. Sometimes medial rotation and lateral rotation is activated along with which group of the hamstring is activated. If medial side is activated, knee flexion, knee medial rotation. If lateral side is activated, knee lateral rotation. But always hamstring is to be active for the knee flexion, for medial rotation or lateral rotation to happen, right? And the other role of hamstring muscles, we saw that there's a knee stability role, especially valgus and varus stability, the role in ACL, the real deloading, or reducing the stress on the ACL, and in the ACL rehabilitation we saw. And finally, in normal day-to-day activities, the role of a hamstring is more predominantly important in the hip than in the knee joint. We saw that also. Yes, and hamstring are very much active in the gait, right? The hamstring muscles has significant role in the gait. Can you predict, or can you just give me which role in the gait does hamstring have? Idea? That is, the hamstring has an activity in from swing phase to stance phase, or stance to swing phase. Okay, they help in knee decreasing the knee extension strength. They help in decreasing the knee extension strength, or slowing the knee extension, or de-accelerating knee extension in late swing phase, and in knee hip extension in stance phase. So these are the role of a hamstring in gait. That is, it has a role from swing to stance phase, or stance to swing phase, and in in late swing phase, this is going to de-accelerate the knee flexion. It is going to control knee extension in the stance phase also, right? Now, I told you that semimembranosus muscle has a role in the menisci, medial menisci. So tear in the semimembranosus muscle will precipitate problems in the medial menisci. Yes, that we will discuss in the pathomechanics session. Let us move on to the pathomechanics of a hamstring, right? Patho. Yes, and it can be weakness, it can be tightness. Yes, tightness. We studied about the weakness, okay? Weakness of the hamstring can reduce the knee flexion strength. Okay? But we saw that in day-to-day activities, the weakness cannot significantly affect our day-to-day activities. So you can mention that in the pathomechanics session of the weakness of the hamstring. Whereas the tightness of the hamstring muscle can cause knee flexion contracture. You know that knee flexion contracture. The tightness of the hamstring muscle can precipitate knee flexion contracture, especially greater tightness. The patient may not be able to, or will not be able to, extend the knee completely. So that will be difficult in patients with the tightness of the hamstring muscles, right? Yes, let us go back. And sometimes there is an overactivity of the hamstring muscles, especially some in neurological disorder, etc. There is a problem in extension of the knee. So tightness of the hamstring can produce knee flexion contracture. Overactivity of the hamstring can produce knee flexion extension problems, or difficulty in extending the knee. Some studies shows that hamstring induce a posterior pelvic tilt. The posterior pelvic tilt, and when there is posterior pelvic tilt, you know that the lumbar curve can flatten and it can produce problems with the lumbar vertebra like low back pain, etc. So the second factor is that it has some role in posterior pelvic tilt. This is a debated one, okay, contradictory one. Has some role in the posterior pelvic tilt, and when there is posterior pelvic tilt, it can decrease the lumbar lordosis and precipitate various problems, right? Yes, and the tear in the semimembranosus muscle can produce problems with the medial menisci and medial collateral ligament also. Medial semimembranosus has a role with the medial collateral ligament, so it can produce a problem with the medial collateral ligament, because we saw that medial collateral ligament, superficial and deep band, it is attached to the ligaments, right, and muscles. Okay, that's all about the role of hamstring muscles in the biomechanics and pathomechanics of knee joint. Now let us jump on to the next muscle, that is a gastrocnemius muscle. Gastrocnemius muscle. You know, you have heard a lot about gastrocnemius muscle, the calf muscle, one of the calf muscles, okay, gastrocnemius muscle. We call it one among the calf muscles, and thus their activity is predominantly in the ankle joint. They help in knee flexion. But their activity is more predominant in the ankle joint. This is the only muscle that crosses both ankle and knee joint. if there is an absence of plantaris. If a plantaris is present, of course it's not. Otherwise, gastrocnemius muscle is the only muscle that crosses ankle joint and knee joint, because you know the origin is from the medial and lateral femoral condyle and inserted into the Achilles tendon. That's beyond our scope of discussion now. Let us walk on to the biomechanics. So the primary function is at the ankle joint. It is a knee flexor when at extension. At full extension, it has a greater role or greater momentum for knee flexion. When from flexion to extension, extension to flexion, when flexion increases, the efficiency of the gastrocnemius muscle to produce motion of flexion decreases, or the momentum of the gastrocnemius decreases. So gastrocnemius has a significant role when knee is nearly in flexion. Their flexion moment is greater, and as flexion increases, as we progress to flexion, gastrocnemius activity decreases. Right? So one of the most significant, remember, is that gastrocnemius muscle is more active in the ankle joint, and the plantar flexion moment is very greater than the knee flexion moment. So the role are knee flexion, plantar flexion, and what you call inversion. Right? Yes. And weakness of the hamstring gastrocnemius muscle. More than that, the weakness of the gastrocnemius muscle can precipitate problem in plantar flexion. The patient will have difficulty in achieving plantar flexion, and of course gait will be difficult. Normal level ground gait and climbing up a hill, etc., will be difficult if there is loss of plantar flexion. And tightness, you can see that will limit the dorsiflexion. It will limit the dorsiflexion, which is also a pathologically problematic situation. So weakness can produce or decrease knee plantar flexion, and tightness can produce difficulty in dorsiflexion. The more details about the gastrocnemius muscle we'll discuss when we go on with the ankle joint. Right? And now we have the next group of muscle, which is known as the sartorius muscle. Yes, the sartorius muscle, the Taylor's muscle, right? The sartorius muscle. The chief function are knee flexion and medial rotation. They have a significant role in hip action, hip flexion. They have a significant role in the hip also. This is the only muscle, even though it is a two joint muscle, because of its large length, because it is the longest muscle, the long length, it is not much affected by the active insufficiency or passive insufficiency. So sartorius is a muscle with, even though it is two joint, it is not subjected to active or passive insufficiency, especially because of its long length. The function are flexion and medial rotation. And you see that the sartorius is chiefly active in the hip joint. Primary action is in the hip, and the secondary action is only there in the knee joint. Yeah, the most important thing that you should remember biomechanically is that the sartorius muscle, you know, it is inserted along with the semimembranosus, gracilis and sartorius, pes anseriens. Sometimes this insertion site can be bit anterior to the normal insertion site. If it is anterior to the normal insertion site, we see a wonderful phenomenon. This muscle, which is a knee flexor, becomes a knee extensor. Right? If the insertion site is slightly anterior, the role of the sartorius becomes a knee extensor. Right? But normally that do not happen. Only in few individuals the sartorius has a role in knee extension. Right? The weakness of the hamstring sartorius muscle is not seen. The tightness of the sartorius muscle, of course, is not much seen, but it can occur along with the hip flexion contracture. The side tightness can restrict the range of motion at the hip and the knee joint. Right? Yes. And now we move on to the next muscle, that is the gracilis. Next muscle is the gracilis. Before that, the gastrocnemius muscle has a function in the gait. That is in the stance phase, when the body is about to accept the weight of the knee is about to accept the weight of the body. Okay? This gastrocnemius work in synchronization with the with the quadriceps and the gastrocnemius, so that it controls the knee flexion. It controls the knee flexion. You know that the gastrocnemius muscle as I told you, is working in synchronization or together with the quadriceps muscle in gait when body weight is being transmitted to the knee joint. You know that the quadriceps gastrocnemius muscle can exhibit a posterior translation on the tibia also, right? Yes, that's just for your knowledge. And sartorius muscle is activated only or active only in the swing phase. Okay, sartorius muscle is only active in the swing phase of the gait. Yes, to the gracilis muscle. The gracilis is an adductor compartment muscle, you know. It is a superficial muscle in the adductor compartment. About the origin, you know, it is pubis, symphysis and pubic regions, and it is inserted into the pes and serians. It is a medial rotator, weak knee flexor also. There is no much significant role, and there is no much significance in weakness and tightness of the gracilis muscle. But what significant role is that gracilis and everyone, all three muscles are the pes and serianus. Okay, what happens is that this has a greater role in stability of the knee joint. This muscle has a very particular group, or these three muscles has a very particular role in providing valgus and rotatory stability. Valgus and rotatory stability in dynamic motion. What is it? Okay, the pes and serianus, that is the gracilis, semimembranosus and the sartorius muscle, together their insertion site is going to provide valgus and rotatory stability to the knee joint, especially in dynamic motion. And you know that in constant twisting motions, especially in football and other sports, there can be a chance of injury to this pes and serianus, and it can precipitate as pes and serian bursitis. There is a bursa that can be inflamed, or there can be pain and inflammation in that site of insertion. That is because if there is no proper strengthening of this group of muscles. So that is one pathomechanics related to the gracilis muscle, that is pes and serianus bursitis, and inflammation around that is the inflammation around the pes and serianus, right? Yes. And now we move on to the last muscle in this session, that is the popliteus muscle. This is a very small muscle which is arising from femoral condyle into the tibia, which is almost in this direction like this. Yes, and the primary role is medial rotator. Yes, the primary role. We saw that in locking and unlocking knee, the popliteus has a significant role. Yes, popliteus has a significant role in unlocking of the knee. But now the study shows that unlocking may occur with even the paralysis of popliteus muscle. That is because it is due to the anatomical structural alteration at that place. That is because the medial condyle is larger, medial femoral condyle is lower or distal. That is why we have the locking and unlocking, and it can even happen without the action of popliteus muscle. But we consider popliteus as a knee unlocker, chief unlocking muscle. The popliteus muscle is also attached to the lateral collateral ligament, the lateral menisci. The popliteus muscle is also attached to the lateral menisci, and it can provide the distraction of the popliteus lateral menisci during knee flexion and extension, along with the role of semimembranosus. The popliteus muscle is attached to the lateral menisci and can help in the posterior translation of the menisci. That is the role of popliteus, which is the medial rotatory role, knee unlocking role, and finally a role in the lateral menisci of the knee joint, right? With that, we are about to wind up the discussion of all the muscles in the knee complex which are acting as flexors, but I want to give you something extra, that is the action of soleus and gluteus maximus. Oh my god, what is this? Can soleus and gluteus maximus affect the knee joint? No, it is not crossing the knee joint. They have no relation to the knee joint, but they can affect the knee joint function. How? Let us see that. For example, here we have the soleus muscle. If we find out the force tension relationship of soleus muscle, or if we divide it into force vectors, we see that this muscle is capable of producing a posterior translation of the tibia, and posterior translation of the tibia is seen in the what? Knee flexion. So soleus has an indirect role in the knee flexion because the force vector shows that this muscle is capable of producing a posterior translatory pull in the joint. And now here you have the gluteus maximus muscle. If we divide it into its force vector, we still see that there is a posterior component for this muscle also, and this component is capable of producing a slight effect of posterior effect of on the knee joint and even the ankle joint. That means the gluteus muscle action, because it's the largest muscle, so it can produce a considerable amount of force, and it can indirectly affect the knee joint and even produce plantar flexion in the ankle joint. Not that the gluteus is producing, but the activation of gluteus can co-activate the other muscles or produce some changes in the joint that can result in the action of knee flexion and even the plantar flexion. Sometimes these studies or this recent evidence are contradictory. I don't want to argue on that, but take it as a hint or take it as an additional thing for your studies. That is, the soleus muscle and the gluteus maximus muscle has some role in the knee flexion and the ankle. Right, with that we wind up this session on the knee flexors. In the next video we will see with the knee extensors and the role of knee extensors along with the patella. Until then, stay tuned. If you like the video, don't forget to click the like button and kindly don't forget to subscribe to our channel.